lucky towns. I like it.
My name is George Tambasas, the National President of the Pharmacy Guild of Australia. I'm here with a colleague of mine, another pharmacist, Andrew Robbo Roberts. Robbo and I used to go to university together many, many years ago. You've been hosting us now for about 4 days out here in the bush.
Yes.
We started in your home country town, otherwise known as...
Well, Jamison's the English name, but Mantamarro is the Aboriginal name, so home of the Mantamarro Magpies.
Yep.
And follow the football.
And this area is controlled by a Aboriginal Health Service called?
Well, it's the Ngarrindjara lands, and so there's a Ngarrindjara Council and it's the Ngarrindjara Health Service that look after an area about the size of Victoria, 11 communities and 10 clinics.
Yep, and we've visited quite a number of clinics over the last 3 or 4 days.
Yeah, we haven't gone to the smaller clinics or the most northern or the most western clinics because they're a couple of days' drive away.
And we've certainly visited and seen with our own eyes the systems that you've put in place, specifically to make sure the medicines are delivered and used and stored in the best possible practice.
In terms of most of remote Australia, we're sort of a limited access, expensive freight of stock, while Australians have access to all the items on the PBS. There are no pharmacies here except for Alice Springs, which is 924k to the east, or to Kalgoorlie, about 1,100 kilometres to the west, and we only have a limited amount of space to put drugs. So, like most remote health services, we run an impress list or a standard drug list, like the Kimberley Territory Health Service, range between 280 to 320 lines, really depending on the health service. We try and keep it best practice, and all our specialists and doctors who come in stick to that formula. We can't cover every disease state, so we have processes in place, much like in the hospital pharmacy, that we can get drugs in for patients for disease states we can't cover from our standard drug list.
So you've showed us the way that the S100 drugs work and the S100 medicines, but you've also showed us how you use the blister packs.
Yep.
Maybe give us a little bit more, and which pharmacies you use and why you use those pharmacies and how fast those medicines come out.
Well, blister packs, we have a largely illiterate population and they live pretty hard and they're very, very mobile. So we have blister packs for people who we know don't move around much. It's because we don't have the logistics to have the medications follow them. So we're working on people who are more stable. We're working with the HACK program so that they can actually help monitor that to as they're giving out meals each day to see whether people have had their tablets, which we're hoping will improve the adherence for our sickest people in the community. But that's quite difficult, and certainly with discharges from hospital, we start working with the hospital on what medication changes are occurring. They get a copy of our impress list so that where possible, we get the impress list pretty much straight away, or get their discharge, pretty much straight away, and we can then the doctor can then write the prescription up, and we can ensure the drugs that they require are where the patient's going to be when they return, which could be a delay of up to 3 weeks of leaving hospital, depending on plane flights in and out of the lands.
Certainly, Greg and I have noticed the distance issues between all these towns that you've taken to us over the last four days. So certainly, maybe touch on the HMR issues that you encounter here in terms of the distance.
Well, for my mob, I don't believe the HMRs fit what we need to do. You need constant, repetitive visitations. Most of them know anatomy from reading bush tucker, but they don't necessarily know that the lungs produce the air go to sort of pump it through into the bloodstream and then through the body to keep us alive. Those sort of things aren't really common. Our last population group walked in from a hunter-gatherer way of life only 30 years ago. HMR has a lot of time trying to explain what their sickness is, because the specialists, the doctors and nurses will have tried, but it's a level of understanding and time. And the way I work, I visit them at their home where they feel more comfortable and can undertake that work. I've been here for 10 years, and after 5 years of living a bit differently than most, where I'm part of the community, they'll prepared to sort of spend a bit more time, and I'm prepared to spend a bit more time with them to understand. I also have another pharmacist who is involved in continuity of care, so every one of our prescriptions gets a review by him before it's supplied, so that sort of review part of the HMR process is already taken as part of our medication reviews, we have people moving from health service to health service to hospital and back again, and keeping track of what medications are on is almost a full-time job.
I just bought this a couple of days ago, but I want you to see who's got the oldest hat on. But what do you reckon, Robbo?
I go through a hat about every year, so this is a year's worth, but I'm on the road a lot. I'm working outside a lot, so you can see I sort of wear bush clothes. I've got steel cap boots on because I'm handling 45 kilogram tyres, as we had a puncher getting here today.
Changed it in about 15 minutes.
Yeah, well, thanks for your help.
Come on, girl. So girl's out being our mascot for the last 4 days. She's looked after us. Robbo, maybe tell the people back at home what sort of cross she is. Don't scare them too much. She's been living with us for 4 days.
So girl, well, she used to be wild. She's a dingo cross. She used to be wild, and in 2005 she really likes being picked up. I kept bribing her with lots of food, and she decided that it was okay being living with me. And then after about 12 months she decided that other people were okay as well. So, but she bounces around for 10 years. Out here, that's a long life for a dog, and
She's looking good.
And everyone knows I'm around. The funniest, I'll give you a quick anecdote. We're at Warburton, and we're staying at the Roadhouse for a meeting. And all of a sudden I hear this lady yell out, "Robbo, I know you're here. I need my I've seen girl. I've got my medicine box to fill up." So she didn't know where I was, but she's seen girl, so I knew I was there. So I broadcast that she needed her medications, and her being around, me being present, even if I'm not speaking to them, it's a reminder that medicines are important. 10 years ago they had no idea what a pharmacist is. Now they know that people go to university just to study medicines. These must be important. Before that it sort of wasn't kicking in. No, look, I appreciate you coming out. There's not really the sort of the 5-star Hilton hotels you'd be used to.
No, I know
and
that.
So you sort of got to ship together. But the thanks has got to go two ways. I'm sort of not a pharmacist owner, haven't been for a long time now. But my work out here was part funded by a guild government agreement. Section 100 money. You've stuck to your word. The first person who visited me out here in 2005 was Lance Emerson, who was then with the guild, probably one of the most help I've had was from PDL, writing specific insurance policies, and John Coppock, PDL being a guild-owned business. So funnily enough, even though I'm a pharmacist without a pharmacy, the guild has been a lot of support over the last 10 years.